In the United States, in 2021, more than 48,000 people died by suicide, and more than 12 million adults gave suicide serious thought.
It's just an extraordinary index of misery and despair. We've got 1.4 million attempts in 2019. A lot of people. Suicide is ubiquitous. No socioeconomic group, no subculture is immune.
Studies have shown that around half of people who die by suicide visit a healthcare provider in the weeks or months leading up to their death, presenting healthcare systems with an opportunity to identify these patients and connect them to care.
When you think about trying to reduce the suffering that people are going through, in particular to prevent suicides, it becomes clear that we should really be screening at every point so that we don't miss the opportunity, because that might be the last time that we have an opportunity to offer some help.
While screening for suicide is a relatively new practice and has not been universally adopted, studies support the efficacy of screening. And in some healthcare systems, suicide screenings are giving doctors and nurses in many different fields of medicine an opportunity to identify people at risk.
Universal screening is just, it's vital in healthcare. We touch so many people who are at risk of suicide, but if we're not asking directly, we're never going to know.
At Hennepin Healthcare in Minneapolis, Minnesota, nurses screen every patient who comes through the doors of the region's busiest Level 1 trauma center for suicide risk, screening about 80,000 patients every year. This approach, known as universal screening, is unusual, as most healthcare systems are only required to screen patients who are already seeking behavioral health care.
This was first presented to us in 2019, and I will say I was a big naysayer of it. I just thought, one more thing to slow us down, one more thing that our nurses are asked to do. This isn't our job.
What brings you in today?
And one of my other concerns was what the patient's response was going to be to those questions. You know, in my mind, boy, I cut my finger on in here to get stitches and someone's asking me, if I have any thoughts of hurting myself. To me, originally I thought that could be offensive.
Sometimes patients might not say that they're thinking of ending their life, that they're at the point where they can't take it anymore. And that does not mean that they don't want to talk about it.
Hennepin Healthcare has trained nurses to ask direct questions about suicide to help identify patients who may need additional care.
Have you had any thoughts like you just don't want to wake up?
Yes, definitely.
What you might be able to do is to open a window so that somebody can talk to you honestly about thoughts they've been struggling with, so you can offer them help.
Well, we're going to get you into a room so you can talk to a doctor, and we'll kind of talk about these thoughts that you're having.
In the first 2 years of screening, Hennepin Healthcare nurses have identified more than 2,000 patients at moderate to high risk of suicide. That's 2 to 3 patients per day. More than enough to change Dr. Schrag's mind.
One of the things that I've realized is every aspect of medicine has a role to play in this here now to take care of the entire patient. And so we all have to do our part. Asking these questions, documenting them, making sure the patient is then in a safe spot, it may really be the most easy and simple way that we can save a life.
Less than 100 miles up the Mississippi River, the Centricare Health System serves the city of St. Cloud and the many rural farming communities surrounding it. Centricare has also implemented universal screenings in all 9 of its hospitals, screening every patient for suicide risk.
It is uncomfortable for a lot of people. I feel it's something we do need to talk about. I think I became more in tune to that after my own loss.
In 2010, Kim's brother Sean died by suicide. As a nurse who performs suicide screenings, Kim is always listening for phrases her patients use that may send up red flags.
Anything sounding final. I'm done. I can't take this anymore. Purpose, I don't know my purpose. I don't know what to do. I've heard all of these statements from patients. I've heard it from family members of patients.
Even before Centricare implemented universal screenings, Kim was listening closely to her patients. She remembers one patient especially clearly. a woman who had been her husband's caretaker for many years until his death.
Somewhere in conversation, she made the comment, I lost my purpose. And I just followed my instinct, stopped what I was doing, reviewed the screening tool, which is easy to do. You just click into another area of the computer. And then I went on to ask her the questions in the Columbia Suicide Screen. And she did answer yes to all of them.
Kim's attentiveness may have saved a life that day. Together, Kim and her colleagues have already identified hundreds of at-risk patients using the screening tool. And while screening alone cannot prevent suicide, it can open the door to essential follow-up care. Patients within the Centricare health system deemed at high risk of suicide are connected to a spectrum of care, often starting with psychotherapy.
A lot of things feel out of control.
Yeah.
For psychotherapist Joel Bershock, suicide loss is deeply personal. At the age of 9, Joel lost his father to suicide. Every day, he helps his patients identify not only risk factors, but also develop ways of coping and strengthening the protective factors in their lives.
Generally speaking, intense suicidal thoughts tend to be fleeting. And so what can we do in this moment to get you through this moment, and connecting with appointments that when you leave here, this is the person you're going to see, this is the date you're going to see them. We do our best to make sure that that's within a week.
We make sure that they also have a clear path back. You'll be following up with your regular provider when you leave, and then we have some therapy set up for you as well. Those are set up to happen within the next week. I think their therapy appointment.
Patients also work with staff to develop a safety plan, a tool patients use after leaving the healthcare system if thoughts of suicide return.
You know, what people and what places help you when you're feeling like a crisis is forming?
Going to my aunt's house.
My colleague, Greg Brown, and I developed a safety plan intervention, and that intervention is used to help people who become suicidal to get through a suicidal crisis without acting on their suicidal feelings and suicidal thoughts. We have them identify what are the things that they can do just by themselves, because a lot of times people get suicidal at night when they are by themselves, that will take their mind off their problems, that will engross them, distract them, even just for a little while. And so they're really simple things. It could be something like playing with their dog.
You know, usually when I'm running, I'll put on some music, put on a podcast, and when I'm out for a run, I'm kind of in a zone.
The safety plan is an important step in the continuum of care for patients who are considering suicide, and it can be changed and adjusted over time as the patient improves. Interventions within the healthcare system, like screenings and safety plans, can help patients before crises begin, an important goal of suicide prevention efforts.
The need is always there. But what I would say is if we can catch people with early symptom onset, the briefer the treatment needs to be, and there's less of that kind of reverberation. And so I think early intervention is so key to people's ongoing kind of mental well-being and stability in the quality of life that they want to choose to have for themselves.
If you are considering suicide, or if you or someone you know is in emotional crisis, please call or text 988 for confidential, free crisis support.